stop you look. Everywhere you look.
Shoulder extension. The client will be seated with practitioners standing beside them. Make sure to check for posture. Prior to beginning the assessment, the practitioner will then demonstrate the movement and ask the client to practice before measuring it. Then, the practitioner will palpate for the inferior lateral acromion process. This is where you will place the goniometer so that the fulcrum and axis of rotation are 2.5 centimeters below the acromion process through the glenohumeral joint. The stable arm should align with the lateral midline of trunk. Movable arm should align with the midline of the lateral humerus. Instruct your client to reach with their arm behind them as far as they can go. For passive range of motion, you will do the same measures but instruct the client to be fully relaxed, and the therapist will move them through the motion. Normal range is 0 to 60 degrees.
Shoulder external rotation. First, you should have the client seated in a chair. The practitioner should be standing on the same side as the extremity being tested. The practitioner should check for posture to make sure the patient is sitting straight up, and then the practitioner should demonstrate proper movement, which is having the shoulder in neutral position, the elbow flexed to 90 degrees, and the forearm in mid position. Make sure to have a towel into the armpit to avoid compensation. Next, the practitioner should palpate the olecranon process and place the fulcrum or the axis of rotation on the olecranon process of the ulna. The stable arm should be parallel with the lateral midline of the ulna. The movable arm should be parallel with the lateral midline of the ulna as well. The practitioner should instruct the client to move your hand away from your stomach. Then the practitioner should measure and document. Next, passive range of motion is the same as active range of motion, except for the practitioner controls and moves the extremity and the patient is fully relaxed.
Shoulder internal rotation. The client should be seated with the shoulder in a neutral position and the elbow flexed at 90 degrees. The forearm is in a neutral position. Make sure to address the posture with the patient. Place the towel in between the arm and trunk, making sure it does not block the goniometer's pathway. The practitioner should be seated on the same side as the extremity being tested. Palpate for the olecranon process to find the axis of rotation for range of motion. Stable arm of the goniometer should be parallel with the lateral midline of the ulna. Place the movable arm in the same position, however, when the patient internally rotates, the stable arm should remain in the initial position. Instruct the patient to move your hand towards your stomach. For passive range of motion, you do the same measures but instruct the client to be fully relaxed and the therapist will move them through the motion.